Hey everyone, I figured today I would go over how to read a summary of benefits. The summary of benefits document, which you should see on your screen, is a pretty standard document for any health insurance plan. Regardless of which carrier you have, this is a document that you should be able to get from your employer or from your group health insurance plan. The language is pretty confusing, as you can imagine, being that it's health insurance, but today I'm going to try to help you try to understand how it all works. Now, there's a lot of things that go into a health insurance plan. I'm going to focus on the things that I look at when evaluating a health insurance plan. So here I have a Blue Cross Blue Shield plan in front of me. It's a pretty popular plan at the moment. And the few things that we're going to look at is the deductible, the out-of-pocket limit, your copays, your prescriptions, lab work, and urgent care. Those are the things that most people are going to utilize. So for this particular plan, at the top, you're going to see what is our overall deductible, and it'll tell you $1,500 per person or $3,000 as a family. If you look a little bit further down, you're going to see what is the out-of-pocket limit. And again, if you've seen my other video on this, the out-of-pocket limit is our worst case scenario for this plan. So that I know that if I'm on this plan, the most that I can spend out is $94.50 over a 12-month period. Now, again, just like my other video explained, that period could be a policy year or a calendar year. So that is something that you just want to confirm. Now, on the next page, on page 2, you're going to go and you're going to see your average things like your office visit copay. Now, again, for this plan, I have a $25 copay visit and only $10 if I'm doing telemedicine. You'll see my specialist copay here, again, is $50. Again, if I'm seeing a dermatologist, a cardiologist, whatever it might be, any type of specialist, that's where I'm going to be paying that specialist copay. However, for office visits for your primary care, it's a $25 copay. Now, you'll see here, preventative care and screening, there is no charge. Deductible does not apply. Now, with this plan, and all plans for the most part, all preventative cases are 100% covered, meaning that for me, I can go get my wellness visit, my preventative care visit one time per year and not pay a thing. My wife can go to her primary care doctor as well as her OB and get everything that she needs to get checked out, and that's 100% covered. The only time I'm going to be paying these copays that we're seeing here is if, maybe I have the sniffles or I have an ear infection, something like that. That's where I'll be paying these copays. Now, you're going to see here, depending on what we need, if it's a diagnostic test or anything like that, I'm going to have certain charges. Now, when it comes to any summary of benefits, usually on the last page, they'll give you a few different examples to try to help you gauge what the cost might be for more routine items. In this situation, they usually always have Peg, she's having a baby. What does it cost, or what does it look like if you had this plan and you had the 9 months worth of office visits, delivery, the whole nine. And again, it kind of breaks it down. So in this situation, the plan's overall deductible is $1,500. So that's something that we have to pay for certain items. Specialist copays, $50. Hospital copay, that's $500. So when you add all these different things in terms of what is most likely going to be needed for a standard normal delivery, I can expect to possibly pay around the $2,160 mark for this particular plan. Now, again, this is assuming certain costs and things like that. Now, that's not going to be the case for all plans. Now, the one thing that we want to make note of is what kind of plan we have. In this situation, in my summary of benefits, I have an EPO, and I'm going to look over here, and it's going to show me that this plan does cover certain services without having to worry about hitting a deductible. Now, again, in here it says deductible does not apply for my office visits, but to be candid, it's not always that clear. So, for example, let's look at another situation where, again, if I'm looking at my office visits, and again, this document is going to be pretty similar amongst all carriers. So that was just a Blue Cross Blue Shield plan. This is a United Healthcare plan. And again, for this particular plan, my deductible is $2,500. My out-of-pocket is $94.50. If I go to page 2, it says that I have a $50 copay for my primary care doctor, $75 for a specialist. Again, my diagnostic tests in terms of x-rays, blood work, depending on what I need, I might have a copay or a coinsurance. Prescriptions here, it says here that my tier 1 retail generic drug is $25 copay. Deductible does not apply. Now, again, for tier 2, that's more your brand name drugs. That's going to cost a little bit more. So for this particular plan, it's a $50 copay. Whereas, on that prior plan that we were just looking at here with Blue Cross Blue Shield, it's a 50% coinsurance for preferred drug costs. So if I'm on an expensive medication, this is where that United Healthcare plan might make more sense. Now, again, if you only have one or two options to choose from, then you're obviously stuck. You have to try to figure out what plan is going to make the most sense for you. And at that point, you're just going to be doing simple math in terms of how many brand name drugs you may be on per month, what that extra cost is for that better plan. But going back to the United Healthcare plan, right? Again, you're going to see the urgent care is a $75 copay. My deductible does not apply. And then again, if I go down to the bottom, Peg is having a baby. Again, now again, my deductible here is $2,500. Again, we're seeing this similar cost. And one thing that you'll notice is that whether it's between this Blue Cross Blue Shield plan or the United Healthcare plan, the total example cost is $12,700, and as it is here with United Healthcare. So it's a pretty similar structure. However, you're going to see here, well, Peg is paying a lot more for this United Healthcare plan, and that's just because your coinsurance, your deductibles, things like that are a little bit higher. So the insurance company does not come to the table as soon as they do with that Blue Cross Blue Shield plan. And obviously, you're going to see these other examples, whether it's Mia simple fracture or managing Joe's type 2 diabetes. But the one thing that we want to remain constant with when reviewing these summary SBCs or summaries of benefits of coverage is what you're going to be utilizing, right? If you're not on any brand name drugs, well, maybe don't focus on that. But for someone like myself who, has 3 young kids and things happen, we might have to go to an urgent care every other month. Well, that's something that I want to kind of focus on when reviewing the summary of benefits. Now, these two plans that I'm showing you now, they're both EPOs. They are not high deductible plans. And as I mentioned before, over here on the right side, it mentions that a lot of services are covered before having to hit this deductible of $2,500, right? If I have the sniffles, I can go and see my doctor and pay a $50 copay and not worry about my deductible. However, there are plans out there where I have a high deductible health plan or an HSA, meaning that I have to hit the full deductible before any benefits are covered. And it should mention that in the summary benefits, or this is something that you can reach out to your broker, your health insurance plan, your employer on, and just try to get some clarity there. For example, for this plan, my overall deductible, now this is an HSA, it says over here, high deductible health plan. Now this is a plan that, again, doesn't cover anything until we hit that deductible of $3,500. So everything that we're going to see here, right? Primary care, 30% coinsurance. Specialist visit, 30% coinsurance. But Jeff, I thought you said, it doesn't say, deductible does not apply or anything like that. And again, that's where reading these can get a little bit confusing. And again, you're going to see here, even though this is a high deductible health plan, and I may not be covered for my office visit to my specialist or my primary care doctor or getting tests done or my prescriptions, nothing on this plan is covered until I hit that deductible, except for preventative care. Again, I get my 1 visit, my wife would get her 2 visits, and those are covered at no charge. And again, everything on with regard to this particular plan is a 30% coinsurance. Now, if we scroll all the way down to the bottom, right, we're back to Peg having a baby. So again, same $12,700 of the example cost. Now they're just filtering that cost through this plan. Well, my deductible is $3,500, and then I have to pay certain coinsurances above and beyond that. So for this particular plan, it's $6,260, right? A little bit closer to that United Healthcare plan. So when you're reviewing these summary of benefits, it's going to give you an idea of what you're looking at with regards to having big costs like having a baby. But again, the things that you want to try to focus on are the things that you think you're going to utilize, whether it's the urgent care visits, certain drug costs, whether it's generic or brand name, the specialist, the primary care, if you're going to have certain tests done, maybe it's an MRI or a CAT scan that you have to have done on a regular basis. But again, the first 2 pages really does give you a good idea of what you're looking at with regards to your health insurance plan. And again, regardless of what the benefits are, you always have that out-of-pocket limit, your worst case scenario in terms of what you would pay in the event that you did rake up, $1 million worth of claims. So we hope this was helpful when reviewing the summary benefits. And again, I can dive into many other carriers, whether it's AmeriHealth, whether it's Cigna, Aetna, all the carriers are going to provide to you a similar breakdown in terms of what it's going to look like for certain services. And again, good old Peg having a baby, or me, a simple fracture. So we hope this was helpful. And if you have any questions or would like more clarity, please reach out so we can make another video, as our goal is to help you better understand your health insurance. Till next time.